Hi, this is Dr. Sarkisian. In this video I will be presenting the orthodontic journey of a very special girl. Pierre Robin syndrome is a congenital condition which, among other things, involves severely underdeveloped jaw bones and serious tooth crowding. These infants are treated very early on in life, as their feeding and breathing would otherwise be seriously impacted. These sketches show how a retruded or backward positioned lower jaw affects a child's profile, and how as a consequence the tongue falls back and blocks the airway. This sketch in turn shows where the tongue should ideally be positioned, allowing for a wider airway. A procedure called distraction osteogenesis is initiated very early in life in these infants, whereby the tiny jawbone is basically split and slowly moved apart with an external mechanism, allowing bone to form in the gap. Fortunately, this little girl does not even remember so far back, but fast forward to age 6, when she was brought to me by her parents. I was initially skeptical and wondered whether her condition would respond to jaw orthopedics. But I was not going to turn back this little angel. If she had bone, and if bone responds to bone growth principles, then we had nothing to lose. On the contrary, her young age would be her only window of opportunity to modify her jaws physiologically and functionally. We just had to proceed slower than normal. We started with 2 cycles of twin block therapy. These appliances work in 3 dimensions of growth: forward, sideways growth, and vertical dimension. In these very simplified illustrations, I try to explain this phase of therapy. The lower jaw here is positioned backwards and is very small. As the child functions with the appliances, the lower jaw is repositioned and tries to adapt to that position, and through that, bone growth centers in the lower jaw start building more bone. Eventually, the lower jaw automatically grows into that position, and we can proceed to the next phase of therapy. Normally, this phase takes less than 1 year on a child who's wearing the appliances 24/7. In this little girl, it took almost 2 years, maybe even more. We know if this treatment has worked when the child, upon biting down without the appliance, naturally bites down more forward, and there's a large space between the back teeth. She cannot bite on her back teeth. Therefore, to consolidate this position, we temporarily build up the lower baby teeth or primary teeth to help her function in this forward and more open position. We are ready to place a few braces and transition to fixed orthodontics. As we see here, she's so crowded that her canines are erupting in front of her lateral incisors. In order to place brackets, I use the water laser to remove some gum tissue and expose the teeth for proper bracket positioning. Here we will be cementing a fixed Arnold expander on the lower arch. This not only anchors the back 6-ear molars, her permanent molars, and prevents them from going backwards, it also continues expanding the lower jaw at a very slow rate. Our very first wires are ultra soft titanium wires. Right after all the brackets are placed, the last thing we do on this day is to perform a laser frenectomy to release the pull of the tight lower frenum or the lip band from the gums around the tooth. Again, some sketches to explain this phase of therapy. This is the transitional phase where the first molars in the back and the upper and lower incisors are coming in. One of the first signs of crowding in this phase in every child is to observe their lateral incisors and how much space there is. And once they start coming through, if they're coming in crowded or twisted, and that already gives us the warning that we should start intervening right away. 3 compelling reasons why we need to intervene early in jaw orthopedic therapy is: 1. The presence of the baby molars allows us to use removable appliances. 2. Children under 10 are much more cooperative in wearing removable appliances. 3. Children under 10 are growing at a very fast rate, and naturally their jawbone will respond favorably to growth modification. 99% of the time, early intervention will eliminate the need for aggressive orthodontics after age 13, where many times 4 healthy bicuspids are removed, or as I say, are amputated to make space. So now, with our patient, we are at the phase where the baby teeth have started to fall out, and we have to transition to fixed braces. Therefore, we have to insert fixed expanders, as I mentioned before, to anchor the back permanent molars, to continue slow expansion of the upper and lower jaws, and to make sure we open up space for the incoming number 3, 4, 5s, or the bicuspids and the canines. We know we still have a long way to go because right here there's barely enough room for the incoming canine. In the next series of photographs, I'm just going to show you how we start bringing in those canines and opening up more space and straightening the teeth and just bringing in every tooth at a time as they erupt. At least another year has passed and most of the teeth are in place. They are looking straight. Her arches are much bigger and she's getting to be a big girl now. And we are revisiting our past and reminiscing. Looking at your old models. Open them up, let's see what they look like. They're so tiny.
Yeah. My thumb is like bigger than the jaw.
Let's see what they look like now.
Mm.
We're getting there, we're getting there. How far back do you go with your memory? Like, do you remember that something was off with your jaw, that you had problems with your jaw?
Well, it's probably like other kids like, hey, like, what's on your neck and stuff like that, and I'd be like, my mouth was too small, so like they had to go and make it bigger. So yeah.
Did they tell you the name of your condition?
Pierre Robin syndrome, I think.
What was it again?
Pierre Robin syndrome.
Oh, okay.
Yeah.
And it's pretty rare, right?
I think so.
So you're something. Yeah. So you're a special person.
Yeah.
You don't remember the surgeries you had?
No.
Mm. But we started making your jaws bigger a long time ago, right?
That was 3rd grade, I think.
Wow.
The end of 3rd grade.
You remember your appliances?
Yeah, it was like the green one and the purple one I had. And there was the gold one and the purple one, which stayed. And the purple one and the red one.
Those?
Yeah. This one was just like the same one, I think. Over and over again. But
you didn't like these too much, did you?
No.
Mm-hmm. They were too big, right?
They were big and like they get like food stuck in them.
Have any room, and your jaw was very, very small.
Yeah.
So now that you have braces, it's a little easier, isn't it?
Yeah.
Right? And we made a lot of room.
Yeah.
You know, thanks to whom we're succeeding?
Oh.
Thanks to you.
Oh. Yeah.
Yeah, thanks to you. Yeah, because a lot of kids wouldn't have all that patience, right? Yeah. Well, no, I have to thank you, because if we succeed, then we succeed together.
Yeah.
We still have a little journey to make, but I think we're almost done, and in maybe about a year we'll fully be done. Yeah?
That's in time for high school.
When are you going to high school?
Year after next.
Yeah? Are you grateful about anything else in your life apart from your teeth?
Yeah. The normal stuff, I guess.
Well, diluted hydrogen peroxide as a mouth rinse, is that okay?
Yeah.
And then sometimes we use yin care. Have you heard of that?
Oh. Like I'm always feel so like soft. How do I bite down?
Carefully.
Almost. Like they look huge.
Now they look huge.
They look ginormous.
They're changing shape, their shape.
I think you're going through a body, but it's the end of an era. This is kind of sad.
It is, right?
It's a little bit sad.
Yeah, you gotta come and visit us now, then pretend we're doing braces. We're gonna miss you.
Yeah. But we'll still be coming for retainers and stuff.
Yeah, we'll still be here quite a bit
So,
after surgery.
yeah.
Yeah.
What would we do without you?
It's so weird to like touch them.
It feels like soap, right?
It's so smooth and like. And now I can eat so many things.
Yeah.
I don't know. I thought the braces were kind of cute.
Oh, they are.
Yeah, I was like, oh, these are nice.
Look at those teeth.
Well, if you have an important event, we can put them back on again.
No, it's okay. These are nice too.
If you want to fit in among other teens, you know, with braces. And